Hello, welcome to my channel. Today I will discuss about the gross anatomy of liver. Here we all know about liver situation, liver weight, liver location, liver surfaces and so many features of liver's functions. Okay, so today I will discuss all about the anatomy of liver. Now, the situation of liver. What's the situation of liver? Okay, liver is situated in the right hypochondrium, epigastrium region, left hypochondrium, and right lumbar. It's the all about of liver situation. Okay, so liver size. What's the size of liver? It's the liver's breadth is 15 to 20 centimeter, length is 17 centimeter, and the thickness is 7 to 14 centimeter. Okay, so anatomically, liver has so many features such as surfaces, border, lobe, ligaments. Okay, so there are five surfaces in liver. Now the first one is superior surface, the second one is inferior surface, the third one is anterior surface, the fourth one is posterior surface, and the fifth one is right lateral surface. These five surface is including from liver. Okay, now the second feature is border. There are only one prominent border in liver, that is inferior border. Okay, so in liver there are only one prominent border, that is inferior border. And now the third feature is lobe. There are five lobes in liver. The first one is right lobe, the second one is left lobe, the third one is caudate lobe, and the fourth one is quadrate lobe, and the fifth one is Riddle's lobe. So here's the first two lobe is called primary lobe, and the second, third, and fourth lobe is called accessory lobe. Okay, so here's the fifth lobe is Riddle's lobe. Riddle's lobe is found in liver sometimes. It's not present in liver always permanently. It's found in liver sometimes. Okay, so it's the five lobe of liver. Now, the fourth feature is ligament. There are two types of ligament in liver. The first one is false ligament, and the second one is true ligament. So, what's the false ligament? Which are the false ligament? False ligament is such as falciform ligament, coronary ligament, right triangular ligament, left triangular ligament, lesser omentums. Okay, and also the true ligament is ligamentum teres and ligamentum venosum. So here's the ligamentum teres is a round ligament. If someone questioned you that give an example of round ligament, then you all have to answer that ligamentum teres is an example of round ligament. Okay, so here falciform ligament is divides liver into right lobe and left lobe in anterior view, and the true ligament divide liver into right lobe and left lobe posteriorly and anteriorly. Again I repeat that falciform ligament divides liver into right lobe and left lobe in anterior view, and the true ligament divide liver into right lobe and left lobe posteriorly and anteriorly. So it's all about the features of liver. Okay, now I will give you all a brief description of the surfaces of liver, such as the first surface is superior surface, anterior surface, right lateral surface, inferior surface. Okay, so in superior surface is in relation peritoneum covering liver, peritoneum covering diaphragm both lungs with parietal pleura, heart with pericardium. Okay, and the anterior surface is divided into two halves by falciform ligament, and it is related to diaphragm and anterior abdominal wall. such as peritoneum covering of liver, peritoneum covering of diaphragm and anterior abdominal wall with its content, rectus abdominal muscle. Okay, so now the right lateral surface. Right lateral surface is related to peritoneum covering of liver, peritoneum covering of diaphragm, costodiaphragmatic recess, lower border of right lung with pleura and 7 to 11th ribs. Okay, and pleural fluid is stored is costodiaphragmatic recess pleurosis. What is pleurosis? That pleural fluid is stored is costodiaphragmatic recess pleurosis. Inferior surface contribution of lobes of liver. So it's all about the surfaces, a brief description of surfaces of liver. Okay, now I will give you a brief description about the lobe of liver, such as right lobe of liver, left lobe of liver. Okay, so right lobe of liver surface is separated. This surface is separated from anterior and lateral surface by inferior border and from posterior surface by posterior inferior border. Okay, it's right lobe of liver. Direction of right lobes of liver is backwards downwards towards left, backward downwards towards left. Okay, now all about the features that. So, in right lobe liver, if we see the right lobe liver anatomically, there are present so many impressions, such as impression of the stomach, impressions of the duodenal, colic impression, renal impression, suprarenal impression, and fossa for gallbladder. Okay, and here's on most important features in right lobe of liver is porta hepatis. Okay, so what is porta hepatis? Porta hepatis is the transverse tissue of liver and also the opening of liver. By porta hepatis, some structures are going in and some structures are coming out from liver. Okay, so which structure is going in? The first one is two divisions of hepatic artery, sympathetic nerve, two division of portal vein, and which structures are coming out? That is two division of hepatic duct, lymph vessels. All these structures are increased fibrofatty tissue called Gleason's capsule from anterior to posterior duct artery vein. Okay, so it is the porta hepatis. So now I will say about the bare area of liver. Okay, the bare area is an important feature in liver, such as the bare area is a triangular area base is formed by tissue for inferior vena cava, and the bare area's upper portion of inferior vena cava lodges into the tissue. So this area is separated from porta hepatis by chordate lobe, and also sometime and conversion it into a tunnel called pons hepatis. It forms the base of the bare area. Okay. Okay, now I will say about the hepatic biliary apparatus system. Okay, so what's the biliary apparatus of liver? Okay, so biliary apparatus in biliary apparatus of liver, they are intrahepatic biliary system and extrahepatic biliary system. Okay, so now I will say say about a brief description of intrahepatic. Biliary passage starts with the livers or hepatocytes. Inside each hepatocyte, bile is formed and passes through the intracellular between two rows of liver cells or hepatocyte. This bile canaliculi is situated at alternate position with sinusoids. So bile is not mixed with the blood due to presence of a single layer of hepatocyte between the bile canaliculi and sinusoids. Okay, and the bile canaliculi unit to other bile canaliculi and come out from the lobule of liver as bile ductule. Bile ductule unit and reunit to others to form hepatic duct. Hepatic duct comes from each lobe of liver through porta hepatis. Okay, it's the intrahepatic and also the extrahepatic. Extrahepatic outside the liver, just below the porta hepatis. Two hepatic duct unit together and form common hepatic duct. Common hepatic duct again units together with cystic duct of gallbladder to form bile duct 3 centimeter away from porta hepatis. Bile duct passes 7 centimeter from its point of formation and ends at the second part of duodenum. Okay, so the extrahepatic biliary apparatus consists of gallbladder and the extrahepatic bile ducts. It's all about the it's all about the discussions from liver, anatomy of liver. If you all like these discussions, and please subscribe.